Good morning, afternoon, or evening, depending on where you're joining us from. My name is Sylvia Levy, and I'm the Communications Officer for the ANH Academy and the Imana program based at the London School of Hygiene and Tropical Medicine. Thank you very much for joining us on this webinar today, co-hosted by the ANH Academy and Ag2Nut on the cost and affordability of nutritious diets globally, where our speakers will discuss findings from the UN State of Food Security and Nutrition in the World Report, also known as the SOFI 2020 report. I hope most of you know about the ANH Academy and our Academy members, but in case you are not, the Agriculture, Nutrition, and Health Academy brings together researchers, practitioners, and policymakers working for better nutrition and health through improved agriculture and food systems. With members from over 100 countries, the ANH Academy is a global network and platform for sharing research and evidence, capacity strengthening, and collaboration across diverse disciplines. If you're not a member yet, we encourage you to please sign up and join the Academy on our site after this webinar. It is completely free to join. As well as convening technical working groups, hosting webinars like this one, and curating a blog, we also have an annual meeting of the Agriculture, Nutrition, and Health community called the ANH Academy Week. 3 weeks ago, we held our very first virtual ANH Academy Week, ANH 2020, where we had 9 interactive learning labs delivered by experts from around the world in the first week, followed by a research conference where we had over 50 abstract-driven presentations, including a keynote speech by Nobel laureate Angus Deaton, and plenary sessions touching on the impact of COVID-19 on our shared work. Resources from the virtual ANH Academy Week, including videos from all of our presentations, oral and poster presentations, learning lab materials, and the recordings of all of the live sessions during the conference are now available on our website at anh-academy.org/ANH2020. We're thrilled to be hosting this webinar mini-series with our friends and colleagues at the Agriculture to Nutrition Community of Practice, also known as Ag2Nut. You can also find information about our recent joint webinars with Ag2Nut on the ANH Academy website. One more announcement before a few housekeeping reminders. Next week on Thursday, the 30th of July, please join us for a second webinar in our mini-series focused on the SOFI 2020 report, and specifically about the hidden environmental and health impacts of diets. We'll hear from Dr. Marco Springman and Professor Joyce Canabo about consumption patterns around the world and what is needed to build a sustainable and healthy food system. We will share the link to register in the chat box and through email also following this webinar. Finally, before we get started, a few technical items so you all know how to participate in today's webinar. First, the webinar is being recorded and posted on our website. All participants have been muted, but please introduce yourselves using the chat box. Let us know your name, where you're joining us from, and the organization you work with. Please also feel free to rename yourself in the Zoom call with the name you would like people to use. Pardon me. You can also note which organization you work with and where you currently live or are staying, like I have. You can access the chat box by clicking the chat button at the bottom of your Zoom window. Later in the session, we will open up the conversation with a question and answer session. If you have questions, we invite you to share them in the chat box throughout the session. You can send your questions at any time, and we'll do our best to raise them during the Q&A. If we have time, we may also ask you to raise your hands so that you can ask your question using the audio function. If at any point you experience any technical issues, please check your audio settings and your internet connection. If you are lost, please try to connect again to the webinar using the same link. That is it for me for now, so over to you, Will. Thanks.
Super, thank you so much, Sylvia, and thanks to everybody for joining. This is such an exciting event for me personally. I've been working in this space for a long time on food prices, trying to understand how they matter for nutrition, partnering with the people on this call who'll be sharing their results, and with many of you. I recognize quite a few names from the ANH Academy Learning Labs that we've had on this subject, and previous meetings where we've done deep dives into particular countries. We started on this work. If you participated in those learning labs, those presentations at ANH Academy, you might know that together with Anna, Yan Bai and colleagues. We did this work in Ghana with Daniel Sarpong, in Tanzania with Fulgence Mishili, and deep dives in other countries. Steve Yerkayatsa in Malawi and others presented their work. And what we're doing today is talking about this global research agenda, which I think matters for all of us, all of you, and everyone has a perspective. So we want to emphasize participation. This is very important for Ag2Nut and webinars, video calls in general. So please do enter questions, comments while the others are talking. I'll be tracking comments and questions, bringing them forward, as will Cecilia and Sylvia. But we also would like to use the yes/no feature of Zoom, if we could, just to get a little bit of a sense of who we are as a group here. So if you click on the participant tab, which will be in most cases at the bottom of your screen, in some cases at the very top, you click on the participant tab, you will see a list of the names, and you'll particularly on the bottom of the list of names, you'll see a yes, a green check with yes, and a red X for no. So the first question I want to ask is, have you ever participated in one of our ANH Academy learning labs? I'll ask another question after this, but let's start with, did you participate in a learning lab? So far we have about 50-50 previous learning lab participants and non-participants, 34 yeses, 36 yeses, 57, 60 no's. So it's about now 2/3 never done a learning lab, 1/3 done a learning lab. So if you did do a learning lab, some of the methods here will be familiar, the data will be new. I want to also ask, so we're at I think just about everyone has answered that. It's about 2/3 no, 1/3 yes. How many of you participated? I'll clear those now. How many of you participated in or saw a presentation of a deep dive in a country? Saskia Depay will share one of them in Mozambique that WFP did. How many of you saw a deep dive for a particular country? So again, those presentations at ANH Academy, other events, only a fraction, actually a smaller fraction, 20 yeses saw one of the deep dives. So I think you'll agree that there's enormous nuance, interest in this topic, and this very global perspective that Anna will share now is a great way to start. And then Saskia Depay from the WFP experience will show how that works for their program activities, especially in Mozambique. So thanks so much for responding to the yes/nos. Please do type in the chat box. We'll have lots of interesting dialogue, I think, and these are great insights that Anna and then Saskia will be sharing now.
Thanks very much, Will, for the introduction. And I'm going to try to share my screen now, make sure that works. Great. So my name is Anna Herforth, and it's great to see you all here for this Ag2Nut community conversation in collaboration with ANH Academy. Thanks so much for hosting and facilitating, Sylvia and your team. And this is definitely a topic that we've talked about a lot in Ag2Nut in terms of linking agriculture and nutrition and what agriculture is able to do for improving access to healthy diets. So I'm really pleased to be able to share some of our own work today to help inform this discussion further with a lot of new data and information, and also to hear a lot of feedback, hopefully, in discussion from the group about what we as a community who work and care deeply about transforming agriculture and food systems for nutrition need to prioritize for making healthy diets accessible. So today I'm going to start by presenting our work on cost and affordability of nutritious diets globally that was done at Tufts University. So for this particular analysis, which was a background paper for the State of Food Security and Nutrition in the World 2020, the UN multi-agency report, This was a background paper of, you can see all of the authors here. So I led the writing, and Jan Bai and Ash Venkat did all of the analysis, really. Lots and lots of hours of work from the whole team. And Christy Mart at IFPRI and Alyssa Abel at Tufts also did some specific analyses. Those aren't covered today, but they'll be in the background report soon to be released. And then Will, really leading this project at Tufts for the last several years and pushing this forward in a lot of connections. So we're going to present this work first, and then we're very fortunate to have Saskia Dupé from World Food Program here to follow on as one of the writers of the SOFI 2020 report to share additional insights from work she's been doing on this topic with her team for many years, and then how that's informing the discussion throughout the UN agencies. For those of you who haven't seen this report yet, it was released last week, and you can find it online. It has two parts. Today, we're not going to be discussing the first part, which is kind of the, it contains the prevalence of undernourishment and hunger statistics that this State of Food Security and Nutrition report publishes annually. This is a really interesting iteration of the report because it's the first time that it has focused on healthy diets. So this part 2 is what we're going to focus on. Today, we're focusing on the section of cost and affordability. And then Saskia will be following up on some more discussion about what's driving the cost and policies and actions to reduce the cost. Next week, we have an opportunity to hear from the author of the other background paper for this report, Marco Springmann, who will talk about the health and environmental impacts of current diets with a response from Joyce Kinabo. So we're presenting this two-part series to kind of unpack a lot of richness that is in this unprecedented SOFI 2020 report. I was so pleased to be able to work on the background paper for this report this year, because I think it's extremely important that we provide metrics and information that match the vision of that was published by FAO for the UN definition of food security almost 25 years ago. So being that food security is when all people at all times have physical and economic access to sufficient, safe, nutritious food to meet dietary needs and food preferences for an active and healthy life. So, as I mentioned, the UN has been publishing this SOFI report every year, but hasn't yet focused on this aspect highlighted here of nutritious food to meet dietary needs. And we really do that with this analysis here. So it is great to be able to inform this global conversation towards achieving this vision in its entirety. Our basic aim here was to use the best available data to answer the question, if you went to an average market in any country, how much would it actually cost you to obtain a diet that satisfies dietary guidelines or nutrient requirements? So is it possible to access that nutritious diet that meets dietary needs? And how many people could not afford this cost? We estimated the cost of 3 different diets. The first one was just the cost of calorie adequacy. So kind of as a benchmark for comparison of the other 2 diets to say, what is the minimum cost to meet just energy requirements using the least cost available starchy staple food in each country? So for example, in a country where there's a lot of rice consumed, what does it cost to just meet energy requirements with rice? This is not an ideal diet, of course. Unfortunately, it is a diet that some people are forced to consume due to lack of access to other food, but it's really a benchmark for comparison. So then we also computed the cost of meeting nutrient adequacy for energy and macronutrients and micronutrients with both upper and lower bounds of the nutrients in question to ensure that all of the requirements would be met with the least cost available items in each market. And finally, we found the cost of a recommended diet. So the minimum cost to meet food-based dietary guidelines, which are based on food groups like fruits and vegetables, protein-rich foods, starchy staples, for example. And these are diets that we calculate the cost for each one in looking at this as a kind of a stairway of affordability from subsistence to health. So first looking at energy sufficient, just what's needed for short-term survival, then nutrient adequate diets to meet required levels of all essential nutrients, and then moving to what we really would like to see for everyone in the world to have access to healthy diets that meet dietary needs for a healthy and active life, long-term, having a balanced proportional diet that is also healthy. So a quick word on the method of looking at least cost diets. We use food price data to find the diet cost in each place that's the most affordable combination of foods to meet the criteria for each of those levels of the diet. So the cost that we're finding is not based on a standard set of set items. The food items that are chosen vary by time and place, drawing on locally available or seasonal items. So for example, in one country, if we're finding, how much does it cost to meet the recommended amount of fruit for the day, it might be mangoes and oranges. And in another country, it might be apples and bananas, depending on what is the lowest cost in each place. And that would shift over time, depending on what's in season. So at every time point, finding the lowest cost set of foods that would satisfy the diet. So with this method, we really are providing a lower bound on the cost per day of meeting each of the dietary standards. And it's important to note that if we then add food preferences or convenience on top of those least cost items, it would raise the estimated cost. So, if we, for example, if we had like canned beans instead of dry beans because they are more convenient, that would be a higher cost item that would not be selected in our least cost diets, but if we did account for it, would raise the cost and the number of people who can't afford the diet. And we do have in our background paper an analysis looking at a metric that's the cost of recommended diets accounting for food preferences, which accounts for local food preferences within each food group. So that we're not presenting today, but we did that analysis as a demonstration that it does raise the cost significantly to incorporate typical patterns of consumption. The food price data set that we use is the World Bank's International Comparison Program data set, ICP, which is a unique data set. It's the only one that has food prices across countries. And its main purpose is to establish purchasing power parity. It is published only periodically, every few years. It's a major effort to collect this data across countries. And we use the latest round of data from 2017, which was just published in May. And that includes 680 foods and non-alcoholic beverages in 173 countries. And these items are limited to standard products that are sold in multiple countries. And that means that there is an inherent limitation of the data set is that it might not include all the lowest cost food items, but it does include quite a wide variety So this is the best available data set. It's the only global data set, and it gives us the best possible estimate we could have of costs by country. It doesn't allow for subnational analyses, but as Will mentioned, we use other data sets for that, and Saskia will present other data sets for subnational analyses today. It also doesn't include the cost of home production of food. It's only the market cost, and that's something we can talk about further in the discussion as well. So our main results using these methods and the global data set is that it costs on average approximately 79 cents in international dollars per day to meet daily energy needs. Then if we want to have the cost for all essential nutrient requirements, the cost goes up significantly to $2.34 on average. Now that, again, it just meets the requirements, but it doesn't have a requirement for proportionality or palatability or other non-nutrient aspects of diet, which are captured in dietary recommendations. So if we add in the cost of meeting a proportional diet that meets recommendations for health, the cost rises to, on average, $3.75 per day in international dollars. The range of that last cost is between $3.29 and $4.58, and that is because our premise for this calculation is that there is no single definition of a healthy diet. So we use 10 different definitions published by UN member states in the form of food-based dietary guidelines, and you can see them all here. We also computed the Eat Lancet diet as a comparison. And so all of these different guidelines have a lot of similarities. You can see visually, there's quite a lot of similarities in proportionality, the types of foods that are included, their general amounts. But we calculate them one by one individually to see how much each set of guidelines would cost. And we come out with a range here. You can see that the guidelines from Argentina, China, Oman, and the US are a bit higher than average. And for Benin, India, Malta, and Vietnam are a bit lower than average. Jamaica and Netherlands come out just exactly on average, and Eat Lancet is slightly less than the average across food-based dietary guidelines, but they're all in a pretty close range. So the key take home here is that by any definition, healthy diets are far more expensive than, first of all, the entire international poverty line of $1.90, let alone if we reserve only part of that poverty line for food and assume that people have to buy other things as well. So if we assume that only $1.20 can be spent on food, by any definition, healthy diets are far exceeding that cost. Here is the global map that Jan produced, and this shows, you can see here, the top is calorie adequacy, the middle is nutrient adequacy, and the bottom is recommended diets. And you can see that the cost of nutrient adequacy exceeds poverty line in most countries, let alone the cost of healthy diets, which exceeds it in all countries. We also did two other affordability comparisons, one to national average expenditures on food, and then a comparison to income, specifically 63% of income, because that's the mean proportion of expenditures on food among the bottom consumer segment in low-income countries. So we found that as kind of a lower bound on what we could possibly expect to have people spend on food. And here we find that average expenditures are almost always, average expenditures on food are almost always above calorie adequacy, but the cost of nutrient adequacy exceeds typical food expenditures in many African countries, and the cost of recommended diets exceeds typical food expenditures in most countries in Africa and Asia. And then when we look at really, can the poor afford these diets, we find that there are many people who cannot. So calorie affordability is still a problem in some countries. You can see at the top, in the middle of Africa, there are many countries where there is some concern about even calories. But then when we look at nutrients, most people in sub-Saharan Africa cannot afford the nutrient adequate diet. And in the bottom, most people in both sub-Saharan Africa and South Asia cannot afford the recommended diet. In all, this leads to estimates that there are approximately 829 million in Africa, 1.3 billion in South Asia, and 326 million in Southeast Asia who can't afford the recommended diet. And overall, we estimate that upwards of 3 billion people globally lack sufficient income to purchase the least cost form of healthy diets that are recommended. This compares to other forms of understanding food insecurity. So 2 billion people published in the SOPHI report this year who experience moderate or severe food insecurity measured by the food insecurity experience scale, and 690 million hungry who can't access adequate calories measured by the prevalence of undernourishment indicator. And I think this progression really makes sense. So we would expect that many more people would experience food insecurity than would have inadequate access to calories. And we would also expect that many more people can't buy recommended diets as compared to those who experience food insecurity, because the way the FIS is measured doesn't have a lot to do with healthy diets. It does have one question out of 8 that asks people if they were unable to eat healthy and nutritious food, although it doesn't have any objective standard for that question, so it's really the perception of that. The rest is worry about food or actually going to bed hungry, questions of that nature. So we would expect that many more people actually might not be able to daily purchase a healthy diet than those who report the more severe forms of food insecurity. And just looking briefly at the cost by food group, we find that starchy staples and oils are a minority of the cost of the diet, accounting for only 16%. The rest is the nutrient-dense foods that are, this is the recommended diet, recommended in proportion for meeting nutrient needs and also protecting health. Looking at fruits and vegetables combined, this alone accounts for 40% of the cost of the recommended diet, alone costing $1.50 in international dollars. So our conclusions here are quite simply, the cost of nutritious diets in the market is more than many people can afford. Therefore, existing food systems and assistance programs are not fulfilling long-standing aspirations for global food security, as laid out in the vision of what we'd like to achieve globally. And this has implications for poverty, for social protection, and for agriculture. The poverty line perhaps needs to be reconsidered in light of these findings, because the food poverty line currently is based on the calorie equivalent of the common diet among the poor. We know this is quite far from the cost of a nutrient adequate or recommended diet. And it seems that the cost of basic needs should consider nutrient adequacy and dietary guidelines intended for all people as basic needs. As far as what's needed for agriculture, this is something that I hope we discuss more. Perhaps agriculture as a form of social protection when markets are not able to currently deliver diverse, nutritious foods. Perhaps there's a role for homestead food production. Here's a photo of healthy diet gardening kits that are provided already in some places by the World Vegetable Center. More broadly, investment, research, and development of many different kinds. And what public and private actions are needed to lower the cost will vary by the location, by the food system, by the type of food. A wide variety of things could happen, and Saskia will go more into some of these examples. But in broad terms, they would have to do with improvements in production, distribution, storage, and trade. And just before closing, I'd just like to summarize here, you know, when we talk about reducing the cost of food, there's sometimes a legitimate concern about reducing the cost of food by externalizing the cost on others, on the environment or on vulnerable groups. So when we talk about reducing the cost of food, we're not talking about doing so by lowering agriculture and food worker wages to something that's unjust. We're not talking about promoting intensive animal production that discounts animal welfare or water quality. We're not talking about cutting down forests to produce more food. We're not talking about trade protectionism. These are all methods to reduce the cost of food, which are not recommended or sustainable. We are talking about investing in research and development of vegetables, fruits, legumes, seeds, increasing diversity in the food supply, and viable opportunities for farmers. We're talking about investing in environmentally and socially sustainable ways to produce animal source foods that are targeted to the poor. We're talking about cold chains for all kinds of these nutrient-rich perishable foods and other means of preservation. And we're talking about market infrastructure to allow the movement of products. So we are wanting to lower costs by diversification and connection, definitely not by externalizing true costs. And there's a lot more to talk about ways to do this. So I will end here by thanking FAO for supporting the analysis, to our funding from the Gates Foundation and UK Aid for our Candasa project at Tufts, which ultimately built on an Imana grant. So thank you to ANH Academy for facilitating this work from the very start several years ago. And I will now turn it over to Saskia. Thank you.
Thank you very much, Anna. Let me share my screen. Yes, it's been a real pleasure to work on the SOFI report and to see the cost and affordability of nutritious and healthy diets featured so strongly. It's really the metric that we're using in our FNG analysis, or Fill the Nutrient Gap, which is a systems-focused situation analysis for nutrition. So I'll be sharing how we use that and some of the findings of that. No. I'm trying to move to the next slide, but it doesn't progress.
Saskia, you might want to stop sharing your screen and then try sharing it again.
Yeah,
to see if that
that's what
works.
I'm attempting here. Okay, yeah. I'll try it again. Just a second. How is this? Yeah, okay. Yeah, so what we do with the Fill the Nutrient Gap assessment, we really want to do a situation analysis to find out what is the right mix for a specific context in the nutrition sensitive and nutrition specific interventions across the life cycle, and how multiple sectors in agriculture, in education, in health, in social protection can contribute to improve the nutrition situation. And really the diet here is key. So we really focus on the adequacy of diets and in understanding what underlies constraints there and what are then solutions to improve the situation in the specific setting. So we first of all focus on clarifying the magnitude and the nature of the nutrient gap to really understand, are diverse foods available? Do people have physical access to the foods, to the markets? What is the affordability, which is a major component? And then what is the choices made within the choice options that people have? So the first three we really see as determining the choice options, and then within that, how are choices made? And really working across the food system, health system, social protection system, to see how those choice options can be broadened. And we do it in a way that involves stakeholders across those systems to further the understanding and then to enable the prioritization of interventions. The analysis has two components. So you see to the right, the linear programming with the cost of the diet, which is the software that Save the Children has developed, is a core component to understand the availability of nutritious foods as well as their cost and then the affordability. And we review secondary sources of information to truly understand how do the different systems perform and what affects people's access. We do it for households and population in general, and then also with a specific focus on specific target groups. So it's really about the food system, understanding what does the consumer have access to, and how can that be improved across the food environment and the supply chain. So what I'll now focus on is on explaining how we use the cost of the diet in this analysis. So we'll look at the extent to which people have choices. So what does the affordability allow for? How large is the gap between the least cost and what people can afford? And who are most affected by that across geographic areas, urban, rural, income quintiles, but also across the life cycle. And then what causes this gap? Is it because of a low diversity? Is it because of cost? Is it because of income? And we often see at subnational level, there is quite some variation. So this is a graph that's in the SOFA report that we contributed. It shows for 29 countries where we have done the FNG analysis, the range of non-affordability of a nutritious diet. You can see that it ranges really widely. Also that there's non-affordability in all countries. And what we often observe is in the urban areas, the non-affordability is lower than in rural areas. So in urban areas, the income is higher typically, and the availability of different foods is higher. So there's more choice and also of more nutritious foods. And this really provides insight that having a nutritious diet isn't only a matter of choice. Affordability really plays into that. This shows for Mozambique a comparison between the geographic variation of non-affordability of a nutritious diet and of the stunting prevalence, and you can see how they align. So where non-affordability of a nutritious diet is higher, I mean, it reaches up to over 70% in those darkest provinces on the top. Then there the stunting prevalence is also very high, 55, 53%. So it makes sense. People don't have financial access to a nutritious diet, and therefore the child can also not have sufficient access, and therefore we see stunting. Of course, there's other factors contributing to stunting also, but the non-affordability of a nutritious diet is also a major component. Staying with Mozambique, and this shows the food supply. And actually the food supply, it's largely grains, starchy roots, some oil, sugar and pulses, but very little vegetables. Also in Mozambique, most foods are from own production. So to diversify the diet here, it would have to come from local production or from increased access to markets. Roads to markets were also really problematic in Mozambique. So that meant that for households, there's not much incentive to produce more diverse foods because there is no way to get it to market and sell it, but also can't go to the market to obtain other foods that people are not growing themselves or that others may be growing. This shows a situation for Pakistan, for the Punjab. The line that gradually goes up is food expenditure, and the highest line is the cost of a nutritious diet. So you can see that almost 70% of households cannot afford that lowest cost nutritious diet. And then the small gray line to the bottom left is the transfer size of the social protection program. So the social protection program provides some income for people, so it alleviates immediate extreme poverty, but it doesn't provide access to a nutritious diet. So in Pakistan, they've developed now a component to this program to add a nutrition-specific intervention during the first 1,000 days to try and break the cycle of malnutrition right there. They can't increase this by much, and they can't increase it for all the recipients. So they've prioritized to address stunting in the extreme poor in that way, adding a component to the social safety net program. This shows the proportional cost of the nutritious diet for the different household members. So a household of 5 members, the highest cost would be for the adolescent girl. And that is because her nutrient needs are so high relative to the energy that she requires. So she needs more of she needs more of the nutritious foods, and those have a higher cost. So it basically translates into her being at a higher risk of deficiencies. So that's likely that she gets from the household supply all the nutrients that she needs. And the next one is the lactating woman. We're also learning some lessons on the food system in fragile settings. And I'd just like to emphasize a few points. One is that there's very high non-affordability of a nutritious diet. And we find this goes over 90% of households unable to afford it. We also find that the price difference between an energy-only and a nutritious diet, so like the first 2 steps on that, those steps that Anna showed, that gap between energy sufficient and nutrient adequate is really bigger in those fragile settings, basically because of the lower range and diversity of the food supply and its higher cost. We also found in some areas it wasn't possible to meet the nutrient requirements. And I should add that in most of those settings, we get the food prices from actual market surveys. So these are quite exhaustive surveys, because then we register all the foods. So only what doesn't reach the market, we would not have a price for. And to add to the complexity, there's the monitoring systems in those settings are very weak, or if existent. So that also really limits visibility. So now to the other component, we use the cost of diet also to then compare what different interventions could make and for whom. So how can we affect that cost of the diet or the affordability of that nutritious diet in order to inform decisions on prioritization. So basically we try and turn on those different levers. So to the right, there can be targeted interventions for vulnerable individuals, children in school, through the health system, micronutrient supplements, the education system, micronutrient supplements through the health system. There can be increased availability of nutritious food, including reduction of post-harvest loss, biofortified crops, then also other ways of fortifying, of improving transport and access to markets, as well as ways to increase household purchasing power. So with stakeholders in country, we analyze what the options are that are being considered, what are they interested in, and then we'll model those with the cost of diet. And I'm going to show you a few examples. So this is again from Mozambique. This is the cost of a nutritious diet in dark blue, and then the household food production, what is currently going on. It can reduce by 8% those costs. If they change the crops, I'm showing here what we modeled for what is going on in terms of production as a model. If they became biofortified crops, it could reduce the cost further, so increasing access. And you can see that the extent to which that can happen varies across the different regions. Then we also do then a combination of different interventions. So what if there was more production at home of specific nutritious foods consumed by children under 2, by adolescent girls. There was a meal in school, and there were biofortified crops in the garden together that could reduce the non-affordability from 54% to 29%. So this, the stakeholders really appreciate seeing that the different interventions all matter, and for a household, they can come from different sectors. So these are then recommendations that were formulated in Mozambique. So for the health sector, they said provide nutrition support to adolescent girls and also prevent teenage pregnancies. The education sector leveraged the school feeding program to provide more nutritious foods to the children, but also have a demand for the producers. Agriculture and the private sector, there was a clear distinction between interventions that matter most in rural areas and those that matter more in urban areas. Like the fortified foods, they are accessible to urban consumers, but not to many of the rural consumers. And then also for social protection and gender, there was a clear recommendation to add social behavior change communication to the cash transfers. And the cash transfers, they are only working in areas with market access. So these F&G results from the different countries that I showed you, they are being used to redesign government social protection policies. They're being used to design new national nutrition policies or an action plan or investment framework, but also to align the nutrition actors. And it's not only oriented towards policies, but we can also do it to inform specific programming. So really we design an F&G assessment together with the stakeholders to inform the questions that are current at the moment. Just a quick map on where we have conducted F&G analyses so far. And in light blue, you see the ongoing ones. We have several technical partners, and I really want to call out Save the Children. It's their software that we use to do the cost of the diet analysis with, and we're really a heavy user of that. Many donors, BMZ is our central donor, and all the other donors, they really make the country analyses possible. So the funding raising is really happening at the country level, which is where the demand for the analysis then comes from. So thank you very much. Over to Anna.
Actually, Saskia, let me just queue up to Anna some of the great questions that have been asked in the chat box. So there's been a lot of activity. I hope you're following the chat box yourselves. Let me just make sure we get answered a question from Carolina that relates something to asked by James. The question from Carolina was, what is the uncertainty of data presented? And James asked a related question, how does it compare with the past? You say something about range of uncertainty in these estimates and anything about changes.
Thanks, and that's directed at the global costs, correct?
Exactly, yes. So this is obviously a snapshot.
Yes. So actually, Yin, would you like to talk about that a little bit? Yeah, and if you want to unmute, you can go ahead. Sorry, I'm not sure if he can unmute himself. Sylvia, if you can help. Thank you.
Right. So I think about uncertainty is a great question. So I think I'm not sure whether this is in SOFI, but definitely in the technical report, we reported different kinds of measurement for uncertainty. For example, we reported like 25% to 75% range for different cost of diet, and also sometimes 95% confidence, the CI confidence interval are used depending on which model, like regression models we have been applied. So that it will be also available in I think multiple research papers that we're gonna submit and also eventually publish. So basically, for the people who are interested in the question, then they can definitely refer to those technical reports and also the papers the academic papers later. Yeah.
Thank you. Yeah, that's really important. And also, as to the question of comparisons to previous years, as I mentioned about the ICP data set, that is unique. It's the only global data set of food prices across countries. We've only shown the analysis for 2017. We've actually only completed that analysis. We are right now working on the analysis of the earlier data set from 2011 so that we can look at change between 2011 and 2017. But this is not a case where we have trend data, because it is actually quite new in the history of global nutrition and nutrition economics to have a data set where we can actually do this analysis. So in the future, we will be able to show trends across time, but this is new.
Excellent. And one other pair of questions, quite interesting. Yuri asks, what exactly is missing from the new?
Bill, we lost you.
So maybe I can pick
I can ask that question.
Oh, Will is back. Yeah.
Will, we lost you when you started asking the question.
Very sorry. So the question was, from Yuri, what is missing from the nutrient adequate diets that's present in the recommended diets? And what is the role of packaged foods in those diets? Was it a second question related to that? That was from several people asked about the presence of packaged foods. So Jan, you might answer that, or Anna?
Maybe I will start with the CONA, the nutrient adequacy. Yeah, and then Anna can follow up with the core recommended diet. So basically, yeah, this is very, very great and also very interesting question. So basically, the cost of nutrient adequacy, and also I believe for most of analysis that Satya is based on, so those analyses are based on the DRIs, the dietary reference intakes, including like essential nutrients. However, you know that for the essential nutrients requirements community, where the standard is also evolving along the time. So then it depends on which standard you are using and what nutrients are included. So for example, in the cost of the nutrient adequacy, we not only include micronutrients, including elements or minerals and also vitamins, right? But we also include the macronutrients like protein, lipids, and also carbohydrates, and also give a range, which is AMDR, accepted macronutrient distribution ranges, to sort of control the balance of the nutrients and also the food selection. However, there will still be some gap between these DRIs and the healthy diet definition, I believe. For example, there is no established fiber, right? Fiber requirement so far. If we do have that one, I think we will have, then definitely the whole grains and the multiple fruits and vegetables will be increased, right? And also like seafood omega-3, which is super important for the CVDs, cardiovascular diseases, and also some other dietary risk factors. However, so far in the best or harmonized, even the most harmonized DRIs, we haven't seen those like consensus yet. So this is the gap between the nutrient adequacy and the healthy diet plan. So it turns out that in most of the cost of nutrient adequacy diet or the food selection, that it will be very or relatively more concentrated in starchy staples and pulses. So pulses are super important to provide like the plant-based like minerals and proteins, of course. So this is about cost of nutrient adequacy diets, and Anna can follow up with the recommended diet. Yeah.
Yeah, thanks, Jan. And the implications of what he was saying about, you know, certain aspects of diet not being captured in nutrient requirements like fiber, and then a whole host of phytonutrients and other aspects of diet, is that dietary recommendations are based partially on nutrient requirements and partially on epidemiology for the types of diets that are seen in research to protect health against NCDs in the long term. So we want both. We want people to have diets for healthy and active lives. And the other thing to say is that the nutrient adequate diet what we presented with the lower cost for Kona is not something that I would recommend as a standard for kind of a poverty line or social protection, because it doesn't take into account proportionality of the diet either, because as Jan was saying, it may be heavily based on starchy staples and pulses, and it varies by country which foods are selected. But it's a diet that in some cases, not many people would want to eat. It's not necessarily proportional, whereas the dietary guidelines will always result in a diet that's palatable and proportional and something that is intended by governments for everyone to have access to. So in our opinion, that is an appropriate standard for the type of cost that's needed for accessing a dignified, healthy diet. Oh, and processed foods. Just a word about processed food. Very quick. They don't appear because they are not, and I'm talking about ultra processed foods. In rare cases, minimally processed foods might appear, like cans of beans, but we select the lowest cost foods to meet requirements, and in no cases did any ultra processed food appear as something that was either recommended or required or least cost in these diets.
Fantastic. And maybe one last set of questions that came up clearly was the basic trade-off between programs that target specific nutrients like biofortification or fortification versus blending, combining foods and that foods that appear naturally. And any thoughts you might have about, especially how Saskia brought that in, comparing the home gardens versus biofortification. Presumably those are things that differ a lot from place to place, but you might have some general perspectives on that. So those questions were asked by several people, Blessing Mahamba, Beatrice Akinyi, and also Rona Bangana.
Yeah. Can I take that, Will?
Please, yes.
Yeah, so we really see that it's about a combination of ways to improve the diet. And the healthy diet is the most diverse of all the diets, and where the non-affordability is high. We're saying, well, the first thing we should really address is the nutrient inadequacy, while we continue to aim for a more diverse diet. And that filling the gap of the nutrient deficiencies, fortification is a great way, whether it's biofortified or it's post-harvest fortified. And at the same time, we must see where those foods are accessible. So really, in each context, it requires a mix, and that mix may differ between the rural area, the urban area, and we can also use like a social protection platform as a way of providing access to those that are most in need of that access to this way of increasing the nutritional value of their diet.
Good. So this has been a great discussion, and people have raised a lot of other questions in the comments, including non-dietary factors like access to water. Those are also very important, obviously care practices, breastfeeding, many things other than this one, but this one is fascinating. And I believe people have a lot of experience, and a key feature of Ag2Nut conversations is this hand raising using Zoom. So please raise your hands, and Cecilia, as host from the Ag2Nut group, will call on you to share perspectives, opportunities, questions you may have from your particular organizations, your particular types of interventions you may be working with, and settings and populations you're working in. I don't see any hands up now, but please do raise comments, questions, concerns you might have.
Yeah, I saw a really good comment from Victor Inga. I don't know if you're wanting to have your comment verbally, you can raise your hand and then we can unmute you. Or if you have any questions, if you have comments, just keep them brief so we can hear from several members of the community. But yeah, I don't see any hands raised yet.
I would be particularly curious to see anyone with experience in dialogue with governments. But there is one raised hand already, yes. Thanks.
Okay, Victor, so I'll unmute you.
And just to note, you can raise your hand by clicking the participants button in the bottom of your Zoom screen. And then in the column at the right, there should be a button at the bottom right that says raise hand.
Yeah, thank
Victor,
you.
please go ahead.
Thank you. Thank you everyone for taking my question. It was really about a comment that I think Anna presented a chart early on about the high cost of fruits and vegetables. I think it was one of the circular diagrams. And I just made a comment that it seems that, you know, when you're looking at affordability of fruits and vegetables, it's quite sensitive to the methodology used. You know, if you're looking at the calorie intake requirements, you know, it's going to appear very expensive. But if you use grams, you know, as the diet intake requirement, you know, it's very inexpensive because, you know, fruits and vegetables are naturally low calorie. So we found that, you know, when we were doing research in Ethiopia, and I was wondering if maybe Will or Anna can make a comment about that. Thanks.
Thank you, Victor.
Yeah, thanks a lot. So that is usually an issue when we look at cost of different food groups relative to each other. But in this case, we actually get around that issue because the cost presented is in terms, it's not in terms of grams or calories, it's in terms of requirement per day. So in most countries, the requirement per day is approximately, you know, 5 fruits and vegetables or 400 grams. It's around that range. Most countries have a recommendation that's similar to the global WHO recommendation of 400 grams of fruits and vegetables per day. So we took the cost in each country of achieving that amount of fruits and vegetables given the least cost items available. And we did that for each set of the 10 different recommendations. You know, some it may have been 400 grams, some maybe 500, some maybe 300, depending on how they specified. We just took the cost of the recommendation per day.
Thank you.
Great question.
We have Nala Wala who raised her hand. So Nala, I will unmute you now. Oh. There you are. Go ahead, Nala.
And can you hear me?
Yes.
Okay. I have been following up with many of you regarding the least cost diet for this part of the world, and looking at the data today, unfortunately, I didn't find anything from the Middle East. And as you all probably know, this is a place in the world that is suffering enormously from food insecurity and from issues of economical and financial problems. So I was wondering how, I have seen many of the world's areas being covered, but I haven't seen anything from the Middle East. Saskia, thank you for the cost of diet.
So thank you, Nala. We do have data for some of the countries in the Middle East, and you can see that in the SOPHI report, looking back at the maps. But Will or Yun, would you like to talk a little bit about the data availability?
I can jump in quickly. Yes, you know, we have been scouring the world for food price data. Now that we're concerned about it, we're looking for it. And it is true, there's big differences across countries in the degree to which they collect prices for diverse foods in the places where poor people shop, where those at risk of malnutrition would or would not have foods available to them. So the need to have dialogue with your country governments, not only about the data they collect, but also about the data they report. So what we found so far is, and I can't speak specifically to the Middle East, but that Many national governments are collecting data which they don't report. Many national governments are not collecting enough diverse foods, and many governments are not collecting prices in the places where people at risk of malnutrition we would need to know whether the foods are available. So I hope that each of you can look on your own national government or where you're working to see the degree to which they are reporting and begin to have that kind of dialogue about this new kind of data that we are just unlocking for the first time now.
And just one thing to add. Yeah, so based on, just quickly look at the maps we produced for Sophie. So I think in the 2017 round, we do have the price data covering like a majority of the Middle East countries. However, the thing that we really miss is the income distribution. So that's why we couldn't estimate the people or percentage of population who cannot afford. So that is also due to data availability question, but just not only the price data, but also the income distribution data. I think we do have just one country, and I think that's Iraq. Yeah.
Thank you. We have payment. Sorry, somehow it got lost. There is Payman Milani, who's raising his hand, and I will unmute you.
Thanks, Cecilia and panelists. Great presentations. In pursuing strategies to achieve nutrient adequacy vis-a-vis a healthy diet, do you guys see any trade-offs and tensions between these objectives, or do you see, let's say, a smooth continuum from nutrient adequacy towards healthy diets? For example, short-term versus long-term, public and private investment, and the like.
Yeah, maybe shall I go first? Yeah. I think they should really be in each other's, it should be a continuum. You aim for a more diverse and a healthier diet that will get you a diet that's giving you more nutrients. But then there's to be a reality check. We see that 3 billion people cannot afford a healthy diet. So where are they in that process, and how much can they maximize their diversity and with that improve their nutrient intake, and what additional measures can there be to add more nutrients into that diet that they can currently have. So I think it should be a continuum. Anna, you want to add?
Totally agree. I think that the metric of the cost of recommended diet is really important because it is, we believe, the aspiration. These are diets that governments have specified are recommended for all people, not just the rich, not just the elite. These are for everyone. So that should be our target. If we're serious about recommended diets and knowing the evidence on health and nutrition, that should be our target. However, as Saskia said, when you have 3 billion people who can't access, there may be immediate needs in terms of essential nutrients that may be a low-hanging fruit for many different types of interventions, but also keeping our eyes on the ultimate goal of diverse and dignified diets for all.
So for the sake of time, I will have one last person who has raised her hand, Lina Arias. If you would like to talk, I will unmute you.
Thank you very much. Thank you, Anna and Saskia, because it's very, very interesting, the presentation that you made. I want to ask a question for Saskia. I know that the full nutrition gap is a very powerful advocacy tool in order to improve the policies. But one minister that is very important to convince is the Ministry of Economy of Finance. And most of the time they work with the cost of effectiveness of the proposals of the alternatives. So I want to ask you if the full nutrition gap make an analysis of cost effectiveness in order to use this tool with this kind of sectors that most of the time need numbers to make change in the policies? Thank you.
Yeah, thank you, Lena. Excellent, excellent question. Yeah, what we find is that an analysis on the economic impact of malnutrition is sort of the first analysis that really raises the interest in that malnutrition is an issue, because it lowers the productivity and the health of people in the short term and in the long term, which raises then the interest to improve nutrition. And this metric of the affordability of a nutritious or nutrient adequate diet and a healthy diet sort of continues in that line, because it talks about cost, it talks about affordability, and that way of speaking about nutrition resonates well with people in finance. The cost effectiveness and the cost benefit, if we look at it for nutrition interventions, we have traditionally looked at it for very defined nutrition specific interventions, but you haven't been able to do it well for nutrition sensitive interventions. And part of the reason is that there we really look at the outcomes of like stunting, of micronutrient deficiencies, and then it becomes really difficult to pool all the evidence because the interventions are so diverse. But if we set the outcome that we aim for at a adequate nutrient intake or a healthy diet, then it becomes easier to have the different interventions ranked with the same metric, which is really what we do with that cost of a nutritious diet and the affordability. And like I showed you from Mozambique, if you compare then, or you bring together the different interventions and see what they together can do, that really helps to also see it more operationalized, because ultimately it's the systems and the sectors in country that should start making a difference. And it's not with one ministry, it's across. So having the Minister of Finance interest and then push, that's really great. And I think with this, yeah, it helps to get their ear.
And one more thing, as in continuing on that, next week when Marco Springmann presents, he will talk about the health costs and the environmental costs of current diets compared to healthy diets. So that's also, you know, some information that can be useful when we're talking about what are the, you know, cost savings from moving from currently consumed diets to something that's more, that's a healthier diet. So stay tuned for the webinar next week and we can discuss that more as well.
Great. Unless there are any last comments, I think that sounds like that's it for us today. Thank you so much, everyone, for joining. This was really fascinating, and thank you for really active chat box. Fantastic to see folks from all around the world really engaging with this new analysis. And we look forward to seeing you next week.
Thanks, everybody. Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you, everyone. Bye-bye.
Thank you, ANH, for hosting.